I'm Jennifer Estep.
My name is Robert Estep, and my son Tristan was diagnosed with neuroblastoma on May 17, 2012.
When we started noticing issues with Tristan, he was walking really funny, had loss of appetite.
An incredibly healthy kid. His whole life, 1 year and 11 months of it to that point. He had never been sick before, but for the last month he had been in and out of doctors' offices and ER with issue after issue. Each and every one of them was, explained away by doctors as behavioral issues or growing pains.
They weren't sure what was going on with him, but they decided to just test him out for the flu because that's what his symptoms, it sounded like, was leading up to. And it came back positive for the flu, so they just sent us home with antibiotics. But there was a black eye on him that he had had for probably 3 to 4 weeks prior.
Back in April, over a month before this, at this point in time, it had started out at what was like a pinprick size bruise just under his right eye.
So we stopped the doctor and had her look at his eye just to be sure. And she told us that it was probably nothing, but she'd go ahead and order some blood labs just to be sure.
So after we were done with the blood draw, we took Tristan home. He went to sleep. Jennifer got home a little later that night, and that's when we got the phone call. The doctor called and said that there were some abnormalities with the blood.
And that for Tristan's age of being almost 2 years old, he needed a blood transfusion at level 20, but he was at a 5.
He needed to go up to a care unit in Tacoma. So on May 15th, I packed my son up for the last time in his home, and we left. The next day, my son underwent a handful of different tests, CT, MRI.
And they confirmed that it was stage 4 high-risk neuroblastoma cancer.
We were transferred to Seattle Children's Hospital, who has one of only a handful of doctors who actually specialize in neuroblastoma.
My name is Lauren Depew, and I'm a research nurse at Seattle Children's Hospital. And Tristan has neuroblastoma, high-risk neuroblastoma, which is an aggressive form of cancer in pediatrics. There isn't a great survival rate, to be honest, for high-risk patients. He's right now on a study, which is why I'm involved in his care, and he's on what's called a phase 3 study. So this is a very large study involving a lot of children, even though there aren't that many kids with neuroblastoma or high-risk neuroblastoma. But at this point, they know this treatment works, and but it's still considered a study because one of the medications he's receiving is not available commercially. This is also aggressive treatment. His initial treatment has also been very intense. He spent about 6 months in the hospital, on and off in the hospital for his initial treatment, and then this treatment also takes about 6 months, in that about 1 week out of the month inpatient, and then other times he's here in the clinic.
As a parent, you constantly worry, and you think sometimes that you have a tendency to fear the worst all too often and too quickly. And the reality is that as parents, we don't really understand exactly what the worst possibly is until it's staring at us in the face.